Good morning. With the impending weather on the way with Hurricane Teddy, I am hopeful that Islanders are prepared for the weather event and stay safe today and tomorrow. I'm pleased to report that there are no new cases of COVID-19 in our province and that our last active case has now recovered. So there are currently no active cases in PEI. As I've said before, we're going to be living with COVID-19 for the foreseeable future. And part of our new normal is carefully managing the risk of transmission and living our new normal lives. And it's all about compromise. By following public health measures in our province, we are working to contain the spread of COVID-19 and avoid taking steps backward. It's important that we work together to not let the pandemic fatigue set in. We do not want to become complacent. What we do now influences the weeks and months ahead, and we do not want to get to the point of reversing restrictions and moving backwards as we are seeing in some of the other provinces. We are very fortunate to have many restrictions lifted here. Our children are in school, our businesses are open, sports and recreational activities are able to continue. And I think we're one of the only provinces that are having provincial championship games. And under our gathering guidance, smaller events are permitted. PEI and Islanders have done a tremendous job so far, thanks to the efforts of Islanders, and we continue to navigate the pandemic, and we will continue to navigate the pandemic this way if we are working together. As I mentioned, across the country, we are seeing an increase in positive cases, and we have seen some school closures and measures that are more restrictive, for instance, in terms of gathering numbers, British Columbia and Ontario. And it's a reminder that what happens in our community does impact what happens in our schools. And as what we do today makes a difference tomorrow. It also serves as a reminder that before attending a gathering, it's important to ask ourselves, is it important that I attend? And are the people attending part of my small social circle? So it is important to assess the level of risk. And we've talked about it before, the ideal conditions for COVID-19 to spread are the 3 C's: close contact for a continuous period in a closed environment. So I'm asking Islanders to continue to keep our social circles small, and we recognize that socializing is important and we need to be around people, but in a pandemic, we also need to be around fewer people with more space. Over the last number of days, 811 has been experiencing high call volumes, which has left some callers reaching a busy tone or a message. And that 811 system, of course, is shared with Nova Scotia, and so Nova Scotia is experiencing the same thing. And although 811 is working to increase its capacity for calls, I'd like to remind Islanders that drop-in COVID testing clinics are available for those who have symptoms and are an excellent option. And these clinics can be accessed without an appointment by anyone who is experiencing symptoms related to COVID-19. And these clinic dates and times are available on the website, but they are in places in O'Leary, Summerside, Borden, Charlottetown, and Montague. There's also information on the website about the COVID self-assessment tool and symptoms. These clinics allow individuals to be tested right away without having to call 811, and they will need to self-isolate for a shorter time period while they await their results. Over the weekend, we added a number of documents to the Renew PEI Together website to help Islanders prepare for what we still are hopeful will be a new normal and what that will look like, including an overview document of the new normal proposed for early October. Other documents that have been added to the site include on multiple gatherings, sports and recreational activities, school outbreak, And by the end of the day today, also Chief Public Health Office school directive and holiday guidance. And I'll mention more about our holiday guidance in a minute. Our ability to move forward into the new normal phase, like all other steps we take, will depend on our situation over the next week or so as we continue to manage and mitigate COVID-19 in our province and also monitor its impact on other provinces. Many of the questions we've recently received are about upcoming holidays and how they will be adjusted in a pandemic. Our holiday guidance document, as mentioned, will be online by the end of the day, and a few highlights include that gatherings of up to 20 people are permitted without an operational plan, and any organized gatherings with more than 20 people needs to have an operational plan. So that's what's in place currently, but it's a reminder. And all the usual public health measures apply to gatherings of any size, and that's the physical distancing between individuals from different households, wearing a non-medical masks when physical distancing is not possible. And food can be prepared and served, but no sharing of utensils, and enhanced cleaning and good hand washing. And of course, anyone who is sick should not attend. And there are many questions about Halloween. And the good news is that door-to-door trick-or-treating can occur, but with precautions in place. Children should only visit households in their neighborhood or apartment building and people they know. No contact treat pickup is recommended, meaning treats should be placed on a table or other surface that can be easily cleaned and disinfected. Treats should not be taken out of a communal dish. And if a doorstep is crowded, please move on or wait until the group leaves. Also, please be respectful of households who may not wish to participate this year. If the lights are off, skip that particular household. As we have moved through the reopening process, more and more Islanders have returned to work. Many of these individuals may be required to travel outside of the Atlantic bubble as part of their work. Islanders should really only be leaving the Atlantic bubble if necessary. Non-essential travel outside the bubble is still not recommended. And we've talked before about essential workers, but really with so many having to travel outside the Atlantic bubble for work and returning to work, we are really talking about workers. And there are healthcare workers, and really a group of rotational workers. It's important that all workers are aware of requirements for testing and isolation when they arrive or return to PEI. And most individuals, as I mentioned, who are traveling outside the Atlantic bubble for work are required to isolate for 14 days upon their return. Self-isolation, and we've heard both terms. Self-isolation requires an individual to stay in their residence or on their property for 14 days. It's the quarantine we've talked about for months. And if you're self-isolating, you must arrange for delivery of food, medication, and other essentials. And we've also talked about work isolation. And there are some workers who, when they return to Prince Edward Island or come to Prince Edward Island, have to go to work. And this might be someone who is specialized in fixing a piece of equipment or machine. There are healthcare workers who are needed at a facility. And it is this group who may need to work isolate. And work isolation is really very similar to self-isolation, but it allows the individual to go to work if they have to and are unable to work at home. They still must maintain physical distancing, wear a non-medical mask, practice good hand hygiene, and monitor for any symptoms. And as with self-isolation, they cannot attend public events or go shopping, and they must arrange for delivery of essentials. And work isolation also involves testing. And then finally, there are Islanders who are rotational workers, and this includes truck drivers, nurses that are traveling north on a regular schedule, camp workers, and other individuals who travel routinely, frequently, and on a set schedule where they're spending at least 50% of their time away from PEI for work and outside the Atlantic bubble. These rotational workers must be tested on a regular basis. This process began early in the pandemic and will continue. And these are rotational workers who travel back and forth frequently and regularly on that set schedule with this testing option. It's really a balance of an acceptable risk of transmission of the virus with the need for these rotational workers to see their families for the limited time they are home. So workers, including healthcare workers, who work outside the Atlantic bubble and return must either self-isolate or work isolate for the most part. And we get many questions about individuals, workers and others, wanting to be tested and skip self-isolation. And we've said at different times, testing is not a means of getting out of self-isolation. It's a way to really identify an infected person at that particular point in time, and it has its limitations, especially with asymptomatic people. Self-isolation is an extremely important public health measure, and it has been successful in containing the spread of COVID-19 and PEI, especially as all of our cases to date have been linked to travel. We expect further details to be communicated and announced with 811, 1-800, our enforcement partners, Health PEI, Operation Isolation, and with industry in the coming days. There will be an expectation that island residents who travel outside of the Atlantic bubble and who are required to work outside of their home when they are back in Prince Edward Island can apply to work isolate effective October 1st via a self-declaration form. And more details, as I mentioned, will be available within the next week. Throughout the COVID-19 pandemic, many people have been going above and beyond in the name of protecting the health and safety of islanders. One of these groups is environmental health. I want to sincerely thank each of our committed, dedicated environmental health professionals, whether they've been screening at points of entry, inspecting businesses, helping to educate businesses and organizations on how to safely reopen and operate, all the while continuing some of their regular day-to-day duties. Thank you for all you've done and continue to do. Often we hear of how lucky we are to be living in Prince Edward Island during this pandemic. And although we're certainly lucky to live in this beautiful province, without the compliance of islanders following important public health measures over the last 6 months, we would not be where we are today. We know what we need to do. We have seen time and time again the process work. Self-isolation, routine testing, physical distancing, good hand hygiene, wearing masks in closed indoor public spaces, staying home when we're sick. These are measures that make a difference. Now that we are several months into the pandemic, I know it's easy to feel frustrated and wish it were all over. And this is exactly why I remind islanders to be patient and kind each week. Everyone is dealing with the pandemic in a different way, and it's challenging for each and every one of us. So I urge us all to be understanding and compassionate. We need to continue to look out for one another and show respect and our kindness always. So continue to be patient and kind. Thank you.
Good morning, everyone. As Dr. Morrison mentioned, we continue to increase testing as more people come forward requiring testing due to having symptoms of COVID-19. These tests are very important in our response, ensuring we catch any cases of COVID-19 that arise in PEI quickly and be able to limit the spread. Now, as more flu and cold-like illnesses occur, we are seeing more tests being performed, particularly at our drop-in clinics. The Charlottetown drop-in clinic alone had 281 patients visit yesterday. Please remember that those individuals, especially children who have COVID symptoms or others who have COVID symptoms, can visit one of the drop-in clinics without an appointment. While anyone with symptoms can attend these sites, remember that there can be a wait, and we ask people to have patience with our staff and with each other as people are lining up for testing. Individuals who are needing testing but do not have symptoms of COVID-19 are recommended to book an appointment if possible to further support our testing clinics' capacity and make it more efficient for you. Islanders can contact their family physician or nurse practitioner for a referral to a scheduled appointment, as well as calling 811. And we know there have been some challenges with the volume of calls to 811 recently, and that's why I think we're both reminding people this morning that if you have symptoms, please visit one of our drop-in centers. All the testing clinic information is available on the COVID-19 section of the government website. I'll remind everyone that the swabs that are retrieved at those testing clinics are processed in our health PEI labs, and we're monitoring this service, recognizing the higher demands on the lab with more tests being done. Negative results are available through the Negative Test Online website for Islanders with a PEI health card. People can begin looking for their results as soon as 12 hours after the swab was taken, but with increased numbers, be mindful that it may take up to 72 hours to have your results posted if they're negative. For international travel, we have begun offering the testing for people who require negative COVID-19 test results for travel to another country. The process to access this testing is different from other testing, and international travelers requiring these tests can call the 1-833-533-9333 number or email covidtravel@gov.pe.ca. They should do this at least 5 days prior to your departure to schedule an appointment for testing, and you'll be given instructions to follow in order to get your test results in time for your travel. As Hurricane Teddy approaches the Maritimes, we're monitoring closely and making preparations to handle any issues that may arise from both COVID and the health PEI services from that perspective. We have proactively canceled the Wednesday drop-in clinic in Montague as it's an outdoor clinic, and it would not be safe to offer that clinic tomorrow with the pending weather. Any additional cancellations to services will be announced, and I'd ask the public to monitor any public service announcements and check for scheduled appointments for regular services if there are impacts due to the weather. Thank you once again to all Islanders who are following the COVID-19 precautions. You are together with us making a real difference here on PEI. To further protect our healthcare system and healthcare workers, we are asking that everyone coming to our health PEI services wear a non-medical mask. This includes when you're coming as a visitor or a support person or as a patient to receive health PEI services or attend appointments. Please remember to bring your mask with you and wear it for your appointment. Exceptions will be made for those with medical conditions which don't allow them to wear a mask. I want to continue to thank the staff and physicians who are making this response possible. While the COVID numbers are low, our work continues, and in some ways it's been more than ever important as the testing increases as the province reopens. We want to support that reopening and maintaining our current status and move towards a new normal in living with COVID-19. So I want to say thank you to everyone who has contributed to this response. Please attend your appointments and seek care if you need it, and remember to wear a mask and be kind to one another. Thank you.
Thank you, Marion. And we'll open it up for questions.
Stu Napies, The Guardian.
Hi, good morning to you both. I actually just wanted to ask maybe a question for both of you, Dr. Morrison and Ms. Dowling. If you could talk a little bit more about the specific CPHO guidelines that have been directed to municipal staff and EMO staff in preparation for the coming post-tropical storm Teddy.
I'll start, Stu. So certainly EMO taking a lead of as their responsibility for the preparation for Hurricane Dorian. And we've not issued any particular guidance, as far as I'm aware, to EMO regarding this particular hurricane, but the EMO, and I know Tanya Mullally has spoken about this, real awareness of all the public health measures to be put in place in all the situations, in the preparation, but also in the aftermath of any hurricane, and so I know that they're very aware of those public health measures and have been using those measures in their communication out to the public, and so I think that's what I understand from the question. I don't know if there's anything particular from Health PEI.
Yeah, I can just add that we have done a lot of preparation, as we do in advance of any storm or weather event that may be coming toward PEI, and EMO does lead that with our Department Emergency Services officers who send that communication and the sites. We have made some specific preparations for this storm with some of our services that are COVID related. In a way, in particular, some of the tents that have been at our long-term care homes that need to be secured or maybe taken down for a short period of time to make sure they're safe. The drop-in testing centers, as I mentioned, Montague, which is an outdoor location, will be closed tomorrow to make sure that's safe for everyone who's there, mitigating any power loss and those types of things. But we do those preparations on a regular basis with our storms that tend to come to the island, both winter and fall.
And Stu, really, Marion referred to it, the EMO works with the designated emergency services officers in all the departments as part of the preparation and lead up. And so that has been ongoing, and even at our points of entry, we've done some extra preparation, of course, with at the bridge and at Wood Islands, but I understand the ferries may have been canceled today. But those are the kinds of things that we would be thinking about within the CPHO with our partners.
Our drop-in testing center at the Eastlink Center as well has been moved indoors for this afternoon, so that, because it's also an outdoor venue, but it's carrying on, but it will be moved indoors to make it safer for people.
Okay, thank you for that. I guess maybe a bit of a wider question for this fall, just on the whole subject of a second wave. You know, we are seeing, of course, a big or a significant increase in cases in Ontario, British Columbia, other parts of Canada. So I guess, you know, sort of a blunt question, yes, no, are we starting to see the beginning of a second wave elsewhere in Canada? And if the answer is not yes, why not, I guess? Like, at what point do we consider it to be a second wave?
So Stu, I think we saw the chief health officer in Quebec say he's worried that this is the beginning of a second wave in his province. There have been other parts of the country, as you indicate, with an increasing number of cases, and really it's sustained increases over a period of time where you really know you're in a wave and not just a little mogul, and those terms have been used by others across the country. So I am watching carefully. I know everyone is what is going on around the rest of the country. I am concerned that this could be the beginning in certain regions of a second wave, and it makes me even that's why the messaging is so key here, that if we're starting to see those increases in cases in other places, that we do everything we can to keep our island and islanders as safe as possible with those cases going on the rest of the country.
Great, thank you.
Carrie Wynn, Ocean 100.
Good morning to you both. Dr. Morrison, you mentioned there was a high call volume coming into the 811 number. I'm just curious as to what the concerns there are or the questions that seem to be prevalent and why such a high volume of calls at this point.
Well, I think, as I mentioned, 811 is being shared by PI in Nova Scotia. It's a shared service, and we're seeing increased number of calls and people being tested, not just in Prince Edward Island, Nova Scotia, but really across the country. We know children are back in school. It's the fall season, so they may be having other viruses that have similar symptoms. And so I think that's why both Marion and I emphasizing today that in Prince Edward Island, and I think this is a little different than in Nova Scotia, if you have symptoms, you don't need to call 811 and wait for them to arrange testing. You can go and get tested. And because I think a large volume of the calls were people calling to see if 811 could help arrange a testing appointment for them. So hopefully, I know 811 is working on it, but it's also a reminder that if you have symptoms or your child has symptoms of COVID, you can get information on the website. You can go directly to one of these testing clinics. And so that has been certainly our understanding of the increased volume of calls.
Well, that's great. That takes me to my second question for Ms. Dowling. I was just wondering about the uptake for the first week for those drop-in clinics, from O'Leary right across to Montague. You mentioned yesterday there were 281 in Charlottetown alone. What's it been like across the province?
Hi, Carrie Wynn. The numbers have gone up quite a bit across the province at our drop-in centers because, as Dr. Morrison mentioned, we are seeing people with an increased number of symptoms. But I think we want to see that service, and we're monitoring it to see what do we need to have in place, what makes sense, but we have seen increased numbers across. The drop-in centers haven't solely been symptomatic individuals, though some of our essential workers that we've had that require repeat testing have been coming there. So we're working internally. Some of those essential workers are health PEI, healthcare workers working in long-term care, for example, who we're looking at alternative options for them to receive their repeat testing because they don't have symptoms of COVID-19, but we're continuing to monitor their status to protect those residents in our long-term care homes. So there's a number of things happening across, but I think we're also looking at what we might need to adjust as we look to move the Charlottetown location and what days of the week and the hours of operation as to what the demand is. So we'll continue to adjust that as we need to.
Great, thanks so much.
Carrie Campbell, CBC.
Good afternoon. I just wonder if anyone can provide an update in terms of how many people roughly would be in self-isolation right now, and then just what the guidance for them is given the coming storm. And we could have situations where emergency responders are coming to their homes, or they'd be required to leave their homes if there are extended power outages. Just what kind of guidance might there be for those people?
Hi, Carrie. I didn't have the exact number, but the last I looked, there were over 750 people in self-isolation, and those are the numbers of people who are getting regular calls to offer support during a period of self-isolation and reminding them the importance of self-isolating. And so, right all the way along, if there's someone who's in self-isolation and they've needed to have emergency care, that's always been something that they need to be able to do. So they would wear a mask, physically distance, make sure that the first responders are aware of that they are self-isolating. So that information they are aware of, and certainly it's also part of the screening for some of the first responders if they need to ever attend a dwelling.
Okay, thank you. And I just wonder, you talked about the coming program where islanders will be able to apply to work isolate. I wonder if you know anything further under, like, what circumstances might that be accepted? Is this for islanders who are working outside the bubble? Can anyone who travels outside the bubble apply for that? Could they go visit family or something and come back and apply? Anything like that?
Well, as I mentioned, Carrie, we'll have more details in the days, and it's really going to be important that we communicate with our number of our stakeholders and as well in those days ahead. But it is really, we're not encouraging people to travel outside the bubble unless they need to for work. But there are some people who have to travel outside for work and may need to work when they get back here, and and there's some people who arrive here in Prince Edward Island who have to work, and that is also to help our islanders and our economy as well. And those are situations where they would have that potential option to work isolate. So, I mean, non-resident workers who are coming in from outside the bubble would need to continue to apply to the Justice and Public Safety for pre-approval travel. So that part won't change. But residents who are having to travel outside the bubble and then return, and they have to work, and so staying at home and working isn't an option, and they need to, for whatever reason, work here, we will be testing them, and they would need a letter from their employer to consider that as an option on re-entry into the province. And so that will be working with our screening coming in, and that's why there'll be a declaration form as well. So there'll be certainly more on that in the days ahead, but it's trying to balance that risk we've talked about, Carrie, before. How do we make sure that we look after islanders, and knowing that there's the risk of importation, but we also recognize that there are people who do have to travel for work, and that we need to balance that, and how do we keep them safe and their families safe, but also the other people they work with safe. And so it's the public health measures plus the testing, and trying to monitor that as we go forward.
All right, thank you both today.
Louise Martin, CBC.
Hi, good afternoon. So I guess a little bit of good news in there for trick-or-treaters in that will go ahead, and you'll be updating the holiday guidance by the end of the day. Can you give us an idea of what, Dr. Morrison, went into your thought process as far as, allowing trick-or-treating, and what will be going into your holiday guidance that we can expect later today?
Hi, Louise. So, I mean, we have looked at our situation here in Prince Edward Island. We have looked at other Halloween and holiday guidance available across the country. And this has been reviewed with a big team of people associated with the Chief Public Health Office. And recognizing that it is, Halloween's over a month away, but and so things can change. But I think we've had lots of questions on Halloween, but also cognizant that there are other holidays that are even before Halloween, such as Thanksgiving, and so it's an important reminder about how to keep safe in certain gatherings, and that are celebrations, we know, for many families.
Thank you very much. And I noticed, we're talking about an increased number of calls to 811, and there's some inconsistencies, it seems, with the lineups at some of the drive-through testing. And I realized just this week in BC, the list of symptoms has been reduced for school-age children, it seems. 10 symptoms have been removed, including sore throat, runny nose, headache, and fatigue. Given sort of we're coming into cold and flu season. A lot of students going in with the sniffles and being sent home and sent for a COVID-19 test. Is that something that PEI would consider, reducing the number of symptoms, to take a child out of school to be tested?
Louise, it's interesting. We talked about that with the team this morning, and we know that children often have very mild or hardly any symptoms at all. So we're conscious that BC made that change, and they are also seeing so many increased number of cases, and they have community spread that it may be that they can't test everyone, and they can only test a certain number. But so at this point, we're going to certainly watch that. We have people on the team on a technical advisory committee that shares that kind of information right across the country. And so we'll continue to look at it, but at this point in time, really we want to make sure we have early detection, and that's why we have testing in place, early detection of our cases so that we can isolate them and minimize transmission. So at this point in time, based on what we know, we wouldn't change it certainly today, but we'll continue to look at it.
All right, appreciate that. Thank you.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'avais moi aussi une question sur Halloween. Est-ce que vous pouvez réexpliquer ce que vous avez dit en français, s'il vous plaît, pour comment ça va se passer le trick or treat pour Halloween cette année, s'il vous plaît?
Bonjour, Laurent. Alors, on vient de recevoir beaucoup de questions à propos d'Halloween, et puis à ce moment, on dit que c'est possible de faire door-to-door, porte-à-porte, trick-or-treating, mais il faut faire attention. Alors, les enfants devraient visiter seulement les personnes qu'ils connaissent, qui sont sur comme la région de leur maison, et dans pas loin de chez où ils habitent. Et puis, s'ils prennent les petits bonbons, ils ne doivent pas mettre la main dans une grande boîte et puis tout enlever les bonbons du même boîte, mais vous pouvez les placer sur une table où ils peuvent enlever un petit peut-être paquet eux-mêmes. Et puis, s'il y en a beaucoup de gens vers une porte, laissez les gens qui sont là partir avant de s'approcher trop près de la porte. Et alors, c'est à ce moment ce qu'on fait, et puis je sais que ça peut changer, mais j'espère que les petites peuvent quand même se déguiser et puis aller trick-or-treating. Mais juste, c'est un peu différent comme tout ce qu'on fait cette année.
OK. Et j'avais juste une autre question concernant la situation au Canada. Vous déconseillez toujours de voyager hors de la bulle atlantique, sauf si c'est pour le travail. Quelles sont les inquiétudes aujourd'hui dans les autres provinces? Est-ce que vous pouvez juste faire un point rapide en français sur la situation au pays?
Alors, la situation au pays, on a des nombres qui montent en Colombie-Britannique, Alberta, Ontario, Québec. Et c'est pas seulement un jour, et ça continue depuis plusieurs jours. Et puis, ça nous inquiète que ces nombres continuent de plus grand nombre. Et puis, c'est plutôt les personnes qui sont un peu plus jeunes, moins de 40 ans. Et on n'a pas tellement de personnes à l'hôpital, mais des fois, il y a 2-3 semaines, c'est comme un lag entre les cas et le nombre de personnes qui sont à l'hôpital. Alors, on va voir qu'est-ce qui arrive dans les 2-3 semaines qui suivent.
Merci.
I think that's it. Thank you very much.